Let's talk about erectile dysfunction today. So I'm going to be using the term ED to describe it. What is ED? It is just a medical term used to describe the inability of a man to achieve or maintain erection that is sufficient enough to cause satisfaction in sexual performance. I repeat, ED, or you call it erectile dysfunction, is the inability of a man to achieve or maintain an erection that is enough to bring about satisfactory sexual performance. Now, ED is not a strange thing. It's something that is inevitable with age. So it can occur in any age depending on the person's situations. Now let's move into the causes of ED. I'm going to classify them into two categories: the physical causes and the psychological causes. Now, talking about the physical causes, these come under the fact that the person, the man, may have some underlying health conditions, such as if he's diabetic, if he has high blood pressure, if he has some problems with his nerves, if he has any spinal cord injury, if he's obese, that's the fat side, and any other health challenge, if he's got prostate issues. Now, coming to the psychological aspect, this has to do with your emotions. This has to do with stress. This has to do with your physical well-being as a person, as an individual. I'm going to take my time to explain all of these causes. Let's dwell on the physical causes first. I want to explain the physical things that can actually cause ED in a man, or make it difficult for a man to maintain erection enough for sexual satisfaction. Number one, a man who is diabetic and he's on diabetic medication. Now, this medication has its side effects that actually reduces the libido in a man. It reduces sexual urge. It reduces, that urge or the feeling of a man to want to, get into sexual, intimacy with his spouse or with his partner. Number two, a man with high blood pressure and he's on those medications. This medication, high blood pressure medications, has its side effect that affects libido in a man. It reduces your libido. So it might be a bit difficult for such a man to be as active as he was before he started taking the hypertensive medication. Number three, an obese person, somebody who is excessively fat. Obesity on its own has a lot of complications. It causes high cholesterol in the blood, and this cholesterol is fatty tissues that block the blood vessel. And when we talk about erection, it has to do with blood flow to the penile area, to the penis of a man. So when the man is on the fat side, there is a tendency that fat might block or obstruct blood flow to the penis for erection to take place. Note, it is not as if they're not going to get erect, but the ability to maintain this erection is what we are talking about. Hormone imbalance. Now, when we talk of hormone imbalance, it's not related to the women alone. In the men, we've got hormones as well that are linked to their fertility. So a man with a low level of a hormone called testosterone will face challenges with his libido and subsequently ability to sustain erection. Substance abuse. I cannot overemphasize on this one. Substance abuse, including excessive alcohol use and smoking. These two things affect erection in a man, and this is the most common one amongst our men today. Excessive alcohol consumption and smoking. What they do is it affects the blood vessel that supplies blood to the penis. So when these blood vessels are affected, definitely there will be some erectile dysfunctions. There's definitely going to be reduction in the ability of that man to sustain erection over time. Now, this may not happen immediately, but excessive alcohol use over a period of time and excessive smoking. Now, I'm taking my time to outline this so that you'll be able to differentiate when your husband has an erectile dysfunction, which is just temporary because of what he's going through, Or when you've observed that this is no longer temporal, this has to do with having an underlying health issue, or you can know the category to place him if he's hypertensive, or if he's diabetic, or if he's taking an antidepressant medication, or if he has prostate issues. You now as a woman can now understand him from that perspective, that okay, I think it is because he's on this medication that he's not really active, or it's because he's actually going through this thing that is not really active. You can know where to start from and seek, so that you know the point where you need to seek help.